More than just Thank you. Welcome to More Than Just Hair, Improving Hair Care Equity in Healthcare. My name is Michaela Lewis, and I will be your facilitator for this presentation. We are so pleased and excited to have you all join us today to continue our Black History Month celebration. During this presentation, our speakers, Serlina Asamoah and Laura Watson, will explore the historical context of hair inequities and share best practices and resources that have been used to implement successful hair equity programs. Serlina Asamoah is a nurse specialist at Nationwide Children's Hospital in Columbus, Ohio. Serlina has been a registered nurse for 20 years. She joined Nationwide Children's Hospital in 2016, where she worked as an educator nurse specialist for Partners for Kids, an accountable care organization for Nationwide Children's Hospital. Partners for Kids serves over 470,000 children, providing care coordination services. In 2019, Serlina accepted a position as an education nurse specialist with the Center for Nursing Excellence, formerly known as the Professional Development Department. Serlina enjoys teaching new and experienced staff members about how to best care for our most vulnerable populations. Serlina specializes in promoting healthcare equity for all children and is currently serving on multiple advocacy boards. Serlina began leading Nationwide Children's Hospital Hair Care Equity Committee in 2020. Leading the committee has been an amazing journey, and because of the work the committee has done, parents and guardians whose children are admitted may choose hair care products and supplies that work best for their child's hair type. The Hair Care Equity Project is a reminder that all patients should be seen as individuals and that it is important that we acknowledge each child for who they are. Providing hair care products for patients is a small way to show that every child is important and deserves only the best of what we have to offer. Laura Watson is an assistant nurse manager, educator, and diversity, equity, inclusion, and belonging facilitator at St. Louis Children's Hospital in St. Louis, Missouri. Laura has been a registered nurse for more than 15 years, working specifically in pediatric, cardiac critical care as a bedside nurse, clinical educator, and assistant manager. Since discovering a passion for DEIB work, Laura has been a part of a number of initiatives, councils, and projects associated with diversity, equity, inclusion, and belonging at the local and national level. She is a member of the Task Force on Teamwork and Cultural Competency, a certified NCCJ St. Louis facilitator, and has just recently been appointed to the Missouri Nurses Association's DEI Task Force. Laura also serves as co-lead for the National Pediatric Cardiology Quality Improvement Collaborative's First Health Equity Improvement Project and is an active member of the Pediatric Acute Care Cardiology Collaborative's Inclusion, Diversity, and Health Equity Advocates Committee. Laura has presented regionally and nationally on topics related to DEIB and health equity and has also co-authored a paper on preventing the harm caused by racism in healthcare. Laura was one of the original members of the Hair Care Equity Project at St. Louis Children's Hospital in 2018 and has served as the project lead since 2020. With St. Louis Children's Hospital being one of the first pediatric institutions to venture into this space, Laura has had the privilege of sharing this work with healthcare organizations across the country. Laura is passionate about advancing equity in healthcare and is fortunate to have friends and colleagues who remind her that the goal should not just be allyship, but to be a true accomplice in the work. Following the hour-long presentation, Serlina and Laura will remain available for a 30-minute question and answer session. As questions arise, you are welcome to either enter them into the chat section or hold them until the end of the presentation. Please join me in welcoming Serlina and Laura.
Thank you so much, Michaela. Those of you who joined early may have heard us already talking about how much we love coming and being invited to speak and share our passion about hair care equity and our various different projects. And so we are really excited to be here today. I want to make sure I don't have the green arrow or the green line around my screen. Can you all see the presentation up?
Yes.
Okay, all right, cool. Let's do this. And let me do this. Perfect. Okay, so as I just said, we get so excited every time someone provides us a platform to come and talk about this topic because we're both super passionate about it. So thank you for having us. And we'll go ahead and get started. So we're going to certainly talk to you about the projects, the hair care equity projects at each of our organizations today. But we're also going to talk about a couple of other things. And we're going to start with historical background. I know for me, it's always super helpful for me to better understand where we are current state if I kind of know the history of how we got there. And so we're going to talk about that as it relates to hair care inequity and hair care discrimination. So first, we'll just do some general history. So just some information that was really, really interesting for me when I learned it, the significance of Afro-textured hair and hairstyles. So, hair has been a huge part of the African culture for centuries. And they're more than just hairstyles. They've always been more than just hairstyles. And they often communicated different things about people. So sometimes they indicated to which tribe someone belonged. The hairstyles may indicate something about family heritage. They may give you indication of how old someone is, what religion they practice. So lots of different things. And then, a part of visual language. So always has been more than just hair. There are so many beautiful African hairstyles with really, really interesting histories, but because we have limited time, we're only going to talk about two of them. But in our references, there are links, and one of them is a link to a much more extensive list that gives you lots of information about where the hairstyles came from. So these are two. So on the bottom are Bantu knots, and that is a traditional African hairstyle that actually originated with the Zulu people in South Africa. And Bantu knots are a symbol of femininity and status. And then up above, those are pictures of cornrows. Cornrows originated in Africa, and they date back to to at least 3000 BC for women and the 19th century for men, particularly in Ethiopia. Warriors and kings were identified by their braided style. And just like we kind of talked about at the beginning, the braids themselves could signify age, religious beliefs, kinship, marital status, wealth, all kinds of things. And it was and still is common for people to adorn the braids with things like shells, glass, flowers, beads, lots of other things just to give additional personality. There are also legends of enslaved people using their braids to convey messages. So like paths of escape, and also hiding grains of rice in their braids to feed their family. During the transatlantic slave trade, I know this fact is not new to anyone, but during the slave trade, when an estimated 12 million African men, women, and children were kidnapped and sold into slavery, one of the first things that slave traders did was shave the heads of the people that they captured. It was a really dehumanizing act, and it was done intentionally because the purpose was to sever ties to one's culture. And that was really, the first part of kind of trying to separate the people that they had captured from their origins and their history and their families and their culture. Head wraps have been around for a really, really long time. They originated in sub-Saharan Africa and were a common part of many African cultures, are still a very common part of African-American culture. The head wraps were an important statement. And just like we talked about the other hairstyles, they often communicated information about a woman's culture or familial practices. In the colonial United States, there were actually a number of laws passed in the 1700s to restrict the choices of Black people, which I don't think is a surprise to anyone. Some of them, so in South Carolina, there was a law that required that Black people had to wear a specific outfit, and they couldn't wear anything flashy or ornate. And one of the things that was forbidden was ornate or festive head wraps for women. In Louisiana, they actually had the opposite law. So they had what was called Tignon laws. And so in Louisiana, they actually required that Black women cover their hair with a kerchief or a tignon. It came out of a belief from white women that the exotic hairstyles of Black women were becoming too enticing to white men. And so they passed this law requiring Black women to cover their hair. Even though women in Louisiana who were forced to cover their hair still found ways to show their personality by adorning their head wraps with various things, it is important that we're really honest and acknowledge that, you know, head wraps, this thing that has been a symbol and a really important part of the African culture for a long time, was really made into a symbol of oppression through white supremacy through these laws. After the Civil War in the United States, there were a lot of popular advertisements that really perpetuated this derogatory caricature and negative stereotype of Black women with head wraps, really linking and closely associating it with servitude and slavery. And so for that reason, during this time, many Black women kind of abandoned head wraps because of the association with servitude and slavery. But later on in the 1980s and 90s, and then in the early 2000s with the natural hair movement, many Black women began wearing them again to honor their roots. This is a picture of India Ari in this beautiful head wrap, and I'll talk about her in just a little bit too, about one of her songs that she has that is specific about the experience of Black women as it relates to hair care discrimination. Colorism and texturism is another part of the historical background of hair care inequity and discrimination. And although we are talking about it in the context of history, it is important to note that colorism and texturism are still issues that people deal with today in 2023. During slavery, there was a caste system that separated enslaved people by their skin tone and hair texture. And I'll talk about this in a few different ways, but ideal features were those that more mimicked European features. So fair skin, straight, less coarse hair. Enslaved people who had more of those type of traits received better treatment than enslaved people, who had darker skin and coarser textured hair. Then there kind of developed this hierarchy of hair types, again, based on European standards of beauty that fed into this narrative that, you know, naturally textured hair was less desirable. There are also things like, you may have heard of the paper bag test. So the paper bag test was literally held up a brown paper bag, and people who had skin lighter than were given different opportunities for schooling, for jobs, for social opportunities than people whose skin was darker than. There was also a comb test in the United States where businesses would put a fine-tooth comb outside of their organization or their establishment. And the implication was that if you could easily pass the comb through your hair, you were welcome to come into the business. If you could not, then you were not welcome to come into the business. We move into the post-slavery period, and these derogatory attitudes towards Black hair and Black people persisted after slavery was abolished. We talked about the European standards of beauty and that really being centered around whiteness. As a result of these attitudes and this kind of these racist beauty standards, many Black people began to use hot combs and harsh chemicals to straighten their hair to more closely mimic European hairstyles and textures. And they also started using things like bleaching creams on their skin to make their skin appear lighter. An entire branch of the beauty industry actually grew as a result of the desire for these things, hair relaxants and bleaching creams. Straighter hair and looser curls became known as good hair and became unofficially the requirement for accessing a broader range of social and career opportunities. And this wasn't just in the United States. These racist beauty standards were really normalized around the world, and again perpetuated this idea that naturally textured hair is unkempt, unacceptable and unprofessional. And that attitude, honestly, in a lot of places continues today. There was a study done just a few years ago in 2016 that's known as the Good Hair Study. And it was really the first study to examine implicit and explicit bias towards Black women's hair. And some of their key findings were that essentially all women worry about their hair. But Black women have a significantly higher rate of feeling social pressure and actual anxiety related to the perceived need that they need to change their hair, straighten, or otherwise change their hair in the work environment. On average, white women showed explicit bias towards Black women's textured hair. They repeatedly rated it as less beautiful, less attractive, and less professional. Then we move into the Black Power movement and a resurgence in Rastafarianism. So in the 1960s, the Black Power movement really embraced this idea that Black is beautiful and encouraged people to embrace all parts of their Blackness as a radical act of self-love. During the Civil Rights Movement, many people the Afro became a symbol of pride and solidarity, and many people wore it as a political statement. Some people wore it in defiance to these racist beauty standards that had really degraded Black hair over centuries. Rastafarianism was actually came about in Jamaica in the 1930s, but it saw a resurgence across the world in the 1960s. And Rastafarianism is actually a faith, but one of the things that they're really known for is wearing their hair in locks. The locks for Rastafarians are really a spiritual connection, and they're a spiritual piece of their faith. It is important to note here, and my friend Serlina shared this information with me not too terribly long ago, and it was brand new information to me, that the term dreadlocks can actually be offensive to some people because of the association of the word dread with things that are disturbing and or disgusting. And so that term was something that was used in persecution of Rastafarians related to their hair. So just information to know, language is important. And then the natural hair movement. So the natural hair movement started in the early 2000s and really encouraged Black people to celebrate the natural characteristics of their hair texture. With the growth of the internet and then more recently social media, people were able to connect in ways that weren't available before. And so people were sharing their natural hair journeys. They were giving each other advice, encouragement, reviewing products, providing tutorials, all of those things that really kind of advanced the natural hair movement. There was also a rise in the visibility of Black people in pop culture. So movies, TV, music, those things. And then India Arie, who I mentioned earlier, actually has a song called I Am Not My Hair. And it is a powerful expression of the experience of Black women related to hair discrimination. If you have a few minutes, it's on YouTube, just look it up on YouTube. It's worth the, I think, 3 to 4 minutes of your time, I promise. So that kind of gets us up to present day in a very, very condensed way. But let's talk about kind of current state in workplace and in schools and how hair care inequity and discrimination shows up in these places. So one of the ways is discriminatory policies. So when we talk about this, I'm talking really about like dress codes or grooming policies. And a lot of times we use this word professional. And you all know I do this a lot and a lot in this presentation because a lot of these words that we use to describe things the words themselves don't actually match the definition of what we're using them for. So it's intentional that I'm doing this. So when we talk about professionalism, if you look up the word professionalism, it really, like the actual definition is related to competency and qualifications. Actually has nothing to do with your appearance. Doesn't tell you which hairstyles are professional and which ones are not. But we as a society have kind of put our own biased definitions into that word. And so a lot of places have dress code policies, right? And so some places, as part of their dress code or grooming policies, have restrictions on the types of hairstyles that are okay. or they outline hairstyles that are not okay. And so one of the things that's really important for employers who do have that in their policy, that it's important that they, if they're going to restrict certain types of hairstyles like braids or locks, they really should be providing a valid reason why these particular hairstyles prevent employees from successfully completing their job duties. If that's not in there and that's not they don't have that rationale, then it really begs the question of why are they restricting those particular hairstyles. In schools, I know dress codes in schools is a hot topic, has been a hot topic for many, many years. These beautiful women, they were 16 at the time. This was in 2017, but the school that they went to had a policy that prohibited anything artificial or unnatural in the hair. And these girls had braided extensions in their hair, and they received numerous detentions. They were prohibited from going to prom. They were prohibited from participating in sporting events because the school said that they were violating the dress code policy. From the school's perspective, it wasn't discriminatory because they enforced that policy equally. We'll talk in a little bit about that's not necessarily the experience of other students in that school, but what wasn't necessarily part of the conversation from the school was that the policy in and of itself was discriminatory. Because if you think about culturally, which students are more likely to have extensions, braids, those types of things in their hair, you will notice that it is disadvantaging one group of students more than another. And so that's not always part of the conversation. We sometimes focus on enforcement of the policy and not looking at the policy itself. Hiring bias. So again, I mentioned the one study previously about attitudes towards Black women's hair. There was actually a more recent one in 2020 from Duke University and Michigan State that looked specifically at attitudes towards Black women with natural hair in the hiring process or in the job search process. And what they found is that Black women with natural hairstyles were perceived to be less professional, less competent, and less likely to be recommended for an interview than Black women with straight hair or white women with any kind of hair. And so it really just reinforced what I think probably for sure what all Black women knew and what other folks kind of knew in terms of how our biases maybe show up. Microaggressions. So we know that that word is a little bit of a misnomer because they're not really micro. They can cause actually a lot of trauma and harm. And so there have been a couple of different studies and things about microaggressions. One in 2019 actually demonstrated that Black employees are more likely than any other group to experience racialized prejudices at work at a rate of about 58%. And they actually broke it down regionally. And so it was about 66% in the West, 56% in the South, 44% in the Northeast. And then Serlina and I are both in the Midwest, 79% in the Midwest. So huge percentage of experiencing racialized prejudice at work. When we talk about hair, and microaggressions, we have to talk about the whole touching of the hair. So Black employees often experience people asking to touch their hair or just touching it without asking, which perpetuates, this narrative that white hair is the default and Black hair is exotic and contributes to the othering of Black colleagues. I want to say real quick, when I say white hair and Black hair, because there's not just two different kinds of hair, there's a very spectrum of hair. I'm talking about it in context of how people are treated at work. So just want to clarify that. And I know Serlina will talk more about like the different types of hair, that it's not as simple as I am making it at this moment. But that happens a lot to people, to Black colleagues, that not only is it, contributing to the othering of them, but it also is a violation of personal space. And then in addition to the physical microaggressions of actually touching people's hair, there are these incessant questions that our Black colleagues get. Is your hair real? I like your hair better when it's straight. Wow, your hair looks really different than it did yesterday. These types of questions and comments, the person asking them may not necessarily realize the impact that they're having, but they do contribute to, people feeling othered and dehumanizing people. And if we just think for a second, like how often do we have those same conversations with our white colleagues? Like how often do we ask our white colleagues or our fellow white students, is your hair real? Can I touch your hair? For most people, it does not happen with the same regularity that it happens with our Black and brown colleagues. Inequitable treatment. So just to revisit the girls in the school that I mentioned earlier. So one of the things that when their story came out, other families and students at the school also shared their experiences that often Black female students were pulled out of class and asked really invasive questions about their hair. Is that your hair? You know, all of these different things. So they were missing class time because they were being interrogated, for lack of a better word, about their hair to see if they were abiding by the dress code policy. There were white female students at the school who had dyed hair, some who also had extensions, who did not experience that same level of scrutiny, did not get pulled out of class and asked those same questions. And so in addition to the policy itself being discriminatory, you know, Black and brown students were also treated differently in terms of how they investigated the policy. Okay, so some people may be surprised. Oh, I'm getting like really ahead of myself. Some people may be surprised that hair care inequity and discrimination is also found in the healthcare system, but it is. So we'll talk about inequitable treatment for just a minute. So let's focus on the patients and caregivers first. So now there's no quantitative data that I'm aware of that demonstrates this, but I know I have anecdotal evidence from my institution, and I know in networking and talking to other folks across the country that there is additional anecdotal evidence of experiences of patients and families within their organizations, that it is not uncommon that Black patients and others with textured hair may not be receiving the same level of care when it comes to basic hair hygiene. And so that is inequitable treatment. In addition, you know, oftentimes, and we'll talk about this in just a second, well, it's the next one up there, lack of necessary products. Most hospitals have a shampoo and a conditioner and a comb that they have available for patients and their families when they are admitted. Most of those things are not designed for naturally textured hair, and in fact can be quite harmful. And so we often kind of expect families to bring those things in, those special things that are really basic things. And so if we think about why people come to the hospital, a lot of times it's in an emergent situation. And so asking people to also remember to bring your hair products is really not also equitable treatment. For employees, I know at our organization, what we found was happening is that the responsibility of providing basic hair care to our Black and brown patients and others with naturally textured hair was unfairly, overwhelmingly being delegated to our Black employees. And so most of them were really happy to do it because they understood not just the, you know, hygiene importance of it, but the cultural and historical significance of it. But it wasn't an equal distribution of workload. We were putting additional work on these employees, which wasn't fair. And then this part, I am going to edit myself on this because I also could talk about this forever. So ineffective testing and diagnostic tools. So EEGs, right, it's a diagnostic tool that we have to look at brain waves and for a variety of different reasons, for seizures, for epilepsy, all that stuff, right? But the quality of the data that we get, which then indicates, or influences kind of our treatment choices or our plans of care, are directly related to the skin contact. So if you look here, right, these electrodes were not meant for people with coarse or curly hair, as were most things not meant for that type of hair in healthcare. And so this beautiful, brilliant woman, she was an undergraduate student at Carnegie Mellon. Her name is Arnell Etienne. And she noticed that patients were being asked to style their hair, sometimes in ways that were damaging. And some patients were actually being asked to shave parts of their head to come in for epilepsy screenings. And she was like, this doesn't seem right. And so she talked with some EEG technicians, talked with some other folks, and was like, okay, help me understand what is the challenge here. And so she then also coordinated with some local beauticians, and they came up with kind of some education for families of like, here are some protective styles that you can do for your hair prior to coming in for this test that will allow us to put the electrodes in the mapping spaces that we need to, and will allow maximum skin contact, which will give us better data and allow us to treat you better because we'll have more data. She and her team then worked with some additional colleagues, and they created these things called SEVO clips or SEVO clips. And they actually help keep the hair out of the way and provide additional kind of or reduce additional impedance to the EEG leads. So this is just one example of, you know, how ineffective testing and diagnostic tools, if we're not taking into account the differences, how that might impact patients and families in healthcare. And then safety concerns, right? So we can talk about physical safety, right? We talk about infection. We talk about, I mean, hygiene is a fundamental part of the care we provide, right? And so, you know, if patients don't get proper hygiene care, it puts them at risk for infections. It can delay healing. It can prolong their hospital stay, which we know puts them at increased risk for contracting hospital-acquired conditions, which we typically think of as things like bloodstream infections and UTIs, catheter-associated UTIs. But there's some growing evidence that racism and racially based health disparities could actually be seen as another preventable harm in terms of the way that patients experience it. And then we talk about the psychological safety piece, right? Providing hygiene care is a really important part of preserving people's dignity. And if we're not doing that, that really has a negative impact on the relationship between patients, caregivers, and providers. And then there's the trauma, right? So if, you know, persistent negligence of basic hair hygiene care could lead to mats and tangles and things that we can't actually fix with combing and may have to cut or shave hair, which is traumatic. Quick note about the Crown Act, and then I'll talk to you about our projects here at St. Louis Children's. So the Crown Act is legislation that prohibits race-based hair discrimination. It has been passed already in the blue states that you see. It has been filed in the pinkish purple states. In the gray states, there has not been anything filed. And you'll notice there are some blue dots in purple states because in some cities and counties, they've passed it even though the state has not. Unfortunately, nationally, it has not passed. They've tried several times. It actually passed the House of Representatives last March with a pretty overwhelming vote, 235 to 189, and then went to the Senate, but the Senate blocked it for a second time in December of last year. So we still have some work to do there. Nevertheless, July 3rd is an unofficial holiday known as Black Hair Independence Day or Crown Day. Okay, so let me talk to you about St. Louis. So I do need to give you a little bit of background about St. Louis because it definitely impacts how we discovered the disparity, that the disparity existed and kind of how we've gone about fixing it, correcting it. So St. Louis actually is right on the border of Missouri and Illinois. So this is Illinois, this is Missouri, and this is the city of St. Louis and then various counties around it. So St. Louis has been on the list of most racially segregated places, cities in America for years and years and years. And so if we look at this map, the pink areas, so these pink areas right here are places where greater than or equal to 80% of the population is Black. This like gray purple area are spaces where race could not be, was not clearly identified. The blue areas are places where greater than or equal to 80% of the population is white. So clearly, there is a significant amount of geographic segregation by race in the St. Louis area. This is just our Del Mar Divide is probably the most infamous example of this geographical segregation. And it's really ridiculous because if you look at this map, so this is Del Mar right here, the street. North of Del Mar, you can see the demographic data. South of Del Mar, you can see the demographic data. And really, for the most part, if you randomly picked a zip code here and randomly picked a zip code here, they would be no more than 15 miles apart, really and truly. And, you know, yes, you see the demographic differences, but there's actually a different impact on health outcomes. So some studies have shown that in a zip code north of Del Mar, so in this red shaded area, life expectancy at birth is around 67 years. And south of Del Mar, in this blue shaded area, it's 85 years. So this is 13 additional years of life just based on your zip code. All right, so just a graphical representation of racial demographics in St. Louis in comparison to what our racial demographics are here at St. Louis Children's Hospital. So nationally, the nursing profession is about 70% white. We are even less diverse than that in terms of our nursing population. Our patient population is about 50% Black or African American, but our nursing staff is overwhelmingly white. And then the diversity is even less when you go up to supervisors and directors. And that's in there because the representation piece is important for having awareness and understanding the cultural significance and the impact of all of these things. So our project. So I will just put all these up here, and I'm not going to read every box, just going to kind of give you an overview. So we are certainly proud to be one of, if not the first pediatric hospital to implement a hair care equity project. But it is important that we're really transparent about what the impetus of this was. It wasn't that we were just like, you know, super in tuned and like, whoa, there are these disparities in care, let's fix it. A family brought a concern forward. A Black family was like, hey, no one's touched my daughter's hair in over a week. Like, that's not okay. And so that really was kind of like the instigating part of like, oh, let's investigate this. And what we discovered is we were talking to people, and at the time, there was only one Black nurse who worked in this unit. Our white nurses were like, oh, we were waiting until so-and-so came on, the one Black nurse that we had to take care of this child's hair. And so we were like, okay, this is not good. Started putting some resources and education together, and then realized, no huge shock, it wasn't just a problem in this one unit. It was a systemic problem throughout our organization that there were these disparities in care. So we formed this collaborative work group. In 2019, before I go on, I know that this is obvious, but I am clearly not a Black woman, and I am not an expert in naturally textured hair. Our work group consisted predominantly of Black women in terms of really deciding the educational content and picking products and that kind of stuff. And so I think that I just want to make sure that I acknowledge that, because I want to make sure that I am not falsely representing any of the work that I have done. 2019 is when we put our educational content together, and I'll talk about that in just a minute. And when we went live, we did do pre and post surveys so that we could see the effectiveness of the project. Getting the actual products in our supply chain system was a monumental task, and it took almost a year. So before then, we honestly were ordering stuff from local places ourselves. Sorry, my animation is a little off there. We were ordering things, and we had created this centralized system within the hospital that we would order things outside of the supply. But what we found is that we couldn't consistently keep things in stock, and so it was negatively impacting the work. So finally, in 2021, we got our products into the supply chain system so that they were easily accessible for people, which increased compliance with actually doing this basic hair care hygiene on a consistent basis with families. Last year, we continued to do some work on the products, did some strategic planning, and then this national webinar series, which Serlene is going to talk about, which certainly was one of the highlights of my time doing this work. Not an advertisement for any particular product, but these are the products that we had that as part of our project. These were the basic products that we decided that needed to be available to everyone. We have additional products available, specialty products for braids and locks and those kinds of things. Our education content was separated into 3 sections, and you can kind of see what's included in there. We didn't want it to just be, here's how you section hair, and here's how you comb out hair, and here's how you wash hair. We also wanted to include information about the historical significance and cultural considerations. We also have a mobile simulation cart. So this is Tracy and Shauna. These are our mannequin heads. And so the goal with this was really to take the hands-on practice, which we got a lot of feedback that that's what people wanted more of, take it to where people are working. And so before COVID happened, we did one small trial with one of our patient care areas. And the goal was for it to be 5 minutes or less. And we just took it to the nurses and we're like, hey, come over here and practice sectioning out this hair. And it was a good opportunity to ask questions. We did do a quick survey. Obviously, there was only 9 people, but 8 of the people found it helpful. So this year we're going to kind of get back into this and try to reinstitute the mobile. sorry, let me get it up. These are just examples of our pre and post survey data. So looking at comfort, confidence, and knowledge, our pre and post survey data demonstrated that folks found the project, the education module, helpful in improving all of those things as it relates to their patient care. We in 2020 were able to have a Zoom meeting with all of these different hospitals to kind of just talk about what we were doing. And some of these folks were starting their own projects as well. And so the networking piece of it has been really exciting. That's how Serlina and I met. We've not ever actually met in person, but we've met on Zoom and Teams a lot. And so I'm going to hand things over to Serlina now. She's going to talk to you about their work at Nationwide and about the webinar series.
Okay, I had to take myself off of mute, and thank you, Laura. Every time I hear it, it's just amazing, your presentation. So thank you for sharing. I just want to also point out, as Laura had mentioned about dreadlocks, it actually was a terminology not using the word dread was new to me as well, but it was one of my team members that worked with me on our hair care equity committee that shared with me that she accidentally said the word dreadlocks. She said, "Oh, I love your dreadlocks," to a woman. And she said in turn, "Darling, there's nothing dreadful about my locks." And so that actually helped us all to realize that, you know, we really probably need to change our terminology with regards to hair locks. So at Nationwide Children's Hospital, we don't use that terminology anymore. So a little bit about NCH, Nationwide Children's Hospital. We treat patients in all 50 states and over 46 countries. We've been named in the U.S. News and World Report in 2022, and actually prior to that as one of the best children's hospitals honor roll. In Forbes, we were also named in 2022 as one of America's best large hospital employers for diversity, and we are the second largest largest children's hospital in the U.S. Behind Dallas Children's, and we are currently working on our 5th magnet designation, so I'm pretty proud of that as well. So why did our project get started? What was it that actually initiated the project? And there were actually 3 instances that happened in 2020 that led us down this path. I'm sure all of you on this call today remember the death of George Floyd, and his death actually impacted not just those of us in the US, but around the world. And so as a result of that, our hospital physicians and some of our staff members decided that we were going to do a hospital-wide event called Little Lives Matter. And that event actually was in honor of George Floyd's daughter, Gianna. So what we did was we all made signs, we involved the community, brought in community kids and their parents, and we made signs saying Little Lives Matter, Black Lives Matter. It was just so many different things that were said during that day. And we held those signs up for nearly 10 minutes. We wanted to see just how long George Floyd had to suffer before he passed away. And what we realized was that holding those signs up for that long was a long time. And so that actually impacted our hospital, our institution, that maybe we need to start looking even closer at health equity for our children. And about 2 weeks later, a coworker of mine actually saw a blog on Children's Hospital Association's website. They always send out these blogs to educators. And the question was, does anyone have any education with regards to textured hair? And she came to me as an African-American educator, nurse educator, and asked, do we have anything? And I said, no, I don't believe so. And I did some research and found out that not only did we not have anything about textured hair, we really didn't have a lot of education on how to take care of anyone's hair. And so this was an opportunity for us to move forward. And thus, this is how the Hair Care Equity Project was launched. Next, Laura. Thank you. And so we actually, we had to obtain a little bit of data. We had to find out what was it that we needed to do? How could we get started? And so we looked at data, which I'm going to speak about in a moment, with regards to what was our percentage of minority patients that we were actually serving at our hospital. We also wanted to know what were the percentages of our minority nurses, and I'll explain that in a moment. And then we surveyed staff to find out how familiar they were with the hair care products that we had on hand, and if there was actually a need for additional hair care products. So we pulled a query. We wanted 12 months worth of data. So we pulled a data query from January to December of 2019. We wanted to know how many patients were admitted for 3 days or greater. And the reason why we selected 3 days or greater was because we were determining that it was around 3 days when a patient would normally need to have their hair washed, unless they were admitted and their hair had blood or debris or something in their hair that really needed attention sooner. And so that's why we chose that 3 days or greater. And then we also wanted to know what the ethnicity percentages were with regards to those patients. So what we found in 2019 that, go back a little bit, Laura, go back one. What we found was more than 23,000 patients were admitted for greater than 3 days. And out of that 23,000, more than 4,000 of those patients were non-white. And that was about 58% of those 23,000 were a little over 58%. About 23% identified as African American or of African descent, 4.2% identified as Asian, and 11% identified as other races. So let's look at our nursing population. So we actually didn't, unfortunately, have data, specific data for our nurses for 19. So we actually pulled data most recently from 21. And what we found was, this is just registered nurses that we're referring to. What we found was that we have about 3,500, a little over 3,500 registered nurses that work at our hospital. And out of that, 88% identified as Caucasians, whereas only 6% identified as African Americans. So why was that important? And the reason is because based on our surveys from our staff, they indicated, as Laura had expressed earlier, that many of our patient care staffs who were African American, those were the ones that were tasked with providing hair care for African American patients. And so we wanted to know what it was that we could do to make a change with regards to that, because it was overtaxing our African American patient caregivers, and also it was also compromising patient care because they were spending so much time on other patients that weren't theirs, that it was taking away time for the patients that they were actually tasked with. So we did additional research, and we found a study through Western Governors University. And what they found was that they estimated by 2044 that more than half of the population will belong to a minority ethnic group. And this study also indicated that nurses from ethnic backgrounds who serve marginalized populations, they're known to improve minority patients' access to care. There are more positive outcomes. It increases communication barriers between a caregiver and the nurse. It also built some trust, and it also provided a certain level of increased comfort level. Now, I want to preface right here that the majority of the nurses that I know at our institution are caring individuals. And I don't believe for one second that they don't try hard every day to help every patient to the best of their ability. However, the research does indicate that most patients do feel comfortable with healthcare professionals who look like them. And also, many healthcare professionals are more comfortable with washing and styling hair that it looks more like their own. And I actually spoke with nurses who've been nurses for 20 years or more, and they told me that this topic has never come up before because when they had a Black patient, they would just always traditionally just hand them off to a Black caregiver to wash their hair because they just didn't know what to do with it. And so we had to make a change. We had to stop that. So we surveyed our staff after reviewing the articles, and there was some shocking responses to the staff surveys that we did. What we found, and these were some of the occupations of the staff members who were surveyed, and they were all people who would potentially touch the hair of a patient that we surveyed. And what we found was that 43% of those individuals weren't even aware that we had hair care products, which I really didn't understand that because every hospital has shampoo. But they did respond that way, so we had to put it there. 75% actually did not believe that they were able to take care of all patients with the hair care supplies and products that we had on hand. So we're going to come to that when I talk about products in a moment. And then 77, almost 78% responded, as Laura has shared, that family members or friends were asked to provide personal hair care products for patient use. And I'm going to stop right here for just a moment because I actually met with our leadership team, and the first question that I asked them when I was trying to gain their support on this project was, do we ever ask a patient or a parent or a patient's friend to bring in a tube of toothpaste for our patients? And everyone said no. And I said, well, do we ask them to bring in soap unless they have some type of special skin need that they may need a different type of soap? And the answer was no. Do we ask them to bring in a toothbrush? Do we ask them to bring in anything that we normally would provide to a patient? Do we ask our parents to bring that in? And the answer was overwhelmingly no. Then why are we asking parents to bring in shampoo and conditioner and hair cream for our African American patients because we won't provide it for them? And no one could give me an answer on that. And that's why I was able to gain the support from my leadership team to move forward and making sure that our staff members knew how to meet the needs of patients with curly and coily hair, because 93% of them that were surveyed indicated that they didn't know how to do that. Next slide. So after we did the data inquiry and our staff surveys, what we did find is that we needed to know what our patients needed for complete care. So let's move on. Our time is getting away from us. We developed a hair care committee, and what that comprised of was 32 members in the group, and it was from various internal and external stakeholders. There were community partners. We pulled in patient education. We pulled in our D&I department. We asked a couple of parents to serve on the committee, and both of them did. And they were wonderful assistants through this project. We got nursing education involved, our supply chain members. We had an occupational therapist that was on our team. We had an inpatient dermatologist who actually has a hair clinic that meets once a week for our patients with alopecia. So she was on our committee as well. And we had an outside dermatologist that served on our committee. And we also asked our Nationwide Foundation, and I'm going to speak about them in a moment. They're part of the Children's Miracle Network, to be a part of that committee as well. And then we brought in community cosmetologists because, they are the experts. Those are the ones that are going to actually give us the right information that we needed in order to provide safe patient hair care. And so what we did with the 32 members were they selected a subcommittee that they wanted to serve on. And the subcommittees were our products committee, education committee, and our policy committee. What I want to say, again, I mentioned earlier about our hospital leadership team, and they were overwhelmingly supportive. Kim Regis was our executive sponsor. She's our executive vice president of operations for ambulatory services. She was instrumental in helping to get a lot of things expedited and approved for us. Dr. Ray Bignell and Valencia Walker were a part of our health equity team, and Stacy Benton for behavioral health. She's a director of behavioral health. She was very helpful and extremely instrumental in making sure this project was successful. I also want to point out that we did, again, we reached out to the two parents and guardians, and I'll speak to them in a moment, but also we asked other parent groups for their advice and recommendations on what would be best with regards to patient care and treating our kids. So our subcommittees, well, our whole committee came up with 3 priorities. These are the things that we wanted to do. And so the first year, I can say that the first 2 things were accomplished. We wanted to improve patient and family satisfaction. We wanted to, and that was based on our patient and family surveys that I'm sure you all are familiar with that go out every year. We wanted to increase our contribution to staff professional growth and enlightenment, and we wanted to provide equitable patient hair care products. So we broke that down even further into goals for each committee. So the education committee created and developed a hair care education curriculum. We also developed a hair care guideline, and we also did find inclusive hair care products. So I'm going to talk really quickly about each of those. Let's speak first on our staff and patient education. As I stated earlier, 72% of our staff members believe that hair care education for various patient hair types would be beneficial in their role. And so we created education that was interactive. You asked questions and answers. They couldn't go beyond one education piece before answering some questions, just to make sure that we were testing their knowledge and understanding along the way. And we also had demonstration videos from cosmetologists on how to wash, condition, and style textured hair. We also had parent testimonials that were included in that education to explain how much the project meant to them and their children. We wanted our staff members to understand the why. And so that's why when we put together this education, it was all inclusive. And I'm just going to briefly touch on a couple of things that were included in that education piece. So as you'll see here, this is a hair table that was designed, and it talks about the various hair types and also a description of each of the hair types. Laura, if you can go to the next slide. So as you saw types 1, 2, and 3, and then you see type 4, and then chemically treated and short styled hair. I want to stop here for a moment because I want to explain to you, as I've explained to our staff members, that sometimes we have an unconscious bias and we attach all African Americans to type 3 and type 4 hairstyles. So if you have tight and coily, or if you have curly hair, then you're more than likely you're African American. What I would like to submit to you is that on these 6 pictures that are noted here, all of them are pictures of my grandchildren. So all of my grandchildren are of African American descent. However, I have 8 grandchildren, and out of the 8, all of them have one of these hair types. type 1 through 4. And so I want people to understand that just because you see a Black child, don't automatically assume that they fall into a certain category, because just like African Americans, there are all ethnicities that we're all different. We are all different shades. We have different color eyes. We have different color hair. We are all made wonderfully, wonderfully made. And so I just want us to identify each individual as how beautiful they really are. So if you go to the next slide, this talks about, this is the actual table that we actually have in our staff education. It's also located in our policy guideline so that our staff can quickly pull it off, print it, and put it up in their unit. And they'll quickly be able to identify what a particular hair type is, what it looks like, how to cleanse, condition, and moisturize that hair type, how to style it, and then what tools that we have on hand in order to provide that care for that patient. We also develop patient education that actually we can print off for our patients to take home. We have a lot of foster care children that come to our hospital, and sometimes those children are matched up with foster parents that may not have the same hair type as them. So they may need additional education as well. So that's why we put together this little packet for our parents as well. We also included cultural considerations. And the reason we did that was because Columbus, Ohio has the second largest Somali population in the US. Outside of, I believe, is Minneapolis has the first as far as population for Somalis. And so we have a lot of children that come in. We have quite a bit of Amish children that come in as well. And so their hair coverings. How do we handle that? How do we have those crucial conversations with our parents when we need to take the hair coverings off for one reason or another for a medical need? And so we wanted our staff to understand that you have to be sensitive to these areas. There's often female patients with hair coverings that are in a room. And so parents may not necessarily want a male caregiver to come in and wash that child's hair. And it's not an insult on the patient staff member. This is their faith, and we have to respect their beliefs. And so we wanted to make sure that we added that in. We also added in different various medical considerations as well, because there may be some sensitivity to some of the products. And so we wanted them to understand and recognize if that's the case, what is it that you would do as a result of that. The other thing that we wanted to talk about, and I'm going to take a couple of minutes to talk about this because it was near and dear to my own heart, is that we had a patient in ICU that had beads in her hair, and she had some pressure injuries as a result of that because she was laying on her head. And bless the nurse's heart, she was doing to the best of her ability, but she cut the patient's hair to get the beads out because she couldn't get them out any other way without consulting with the mother. And so when the mother came in, she was of course shocked and upset about it. And so we wanted to include in our education that you need to have these crucial conversations with your parents first, before you take scissors to a patient's hair, or before you start taking things out of their hair, because braids are very expensive. They're a few $100s to put them in, and it's hours and hours to put them in. So there's a lot of effort that goes into that. And so we wanted to make sure that our staff understood that, oh, this is not something where you just go to a hair store and you buy hair and you just put it in and it takes 5 minutes and you can just take it right back out. No, we needed our families, our staff caregivers to understand the importance of this, not just from a cultural perspective, but from a financial perspective for a parent. And so now our staff are more careful when they are approaching our patients, when they do have things that are in their hair. But now I'm going to talk about our products and supplies. Dorcas Liu is our product analyst. And So she actually was the one who was instrumental in leading our products committee. And so if you can actually go to the next slide for me, Laura. These were some of the supplies that we actually had on hand at NCH at the time, prior to our committee deciding on different products. And we always have this running joke that with our baby shampoo and body wash, and if those of you who've worked in a hospital, you may have seen something similar. Our running joke is that even the NICU babies don't like it because it just leaves their hair hard and it's not good for anybody's hair. And so we had to have that crucial conversation with our supply chain that, hey, this product doesn't work for anybody. And so we were able to find a product that actually works for everyone. The other thing is I call the comb that's listed there, I call that the picture day comb. For those of you who were in elementary school, you remember the combs that they would give you to take a picture. Well, that comb didn't work for anybody. I know people's hairs were flying all over the place after using that comb, and it's because the comb doesn't work. So we have better combs now. So that's really a good thing. And then that brush, it will not get through, especially a type 4 curly or coily hair. It's not going to get through, and it's probably going to break because it's so cheaply made. So we looked at the winning products, but before I talk about this, I do want to tell you a really quick story. In our behavioral health unit, we have a behavioral health pavilion, and actually it's the very first behavioral health hospital for children in the country. Big Lots actually donated the funds for the building, and we're very proud of that institution. But there was a certain patient who was, she was an African-American teenager, and she refused. She had been admitted for probably about a month or so, and she refused to go to therapy sessions, so group therapy sessions. And the nurses would always write on her chart, patient is non-compliant, will not attend group therapy sessions. And so my good friend, Stacy Benton, the director, she actually went on the floor and she looked at the patient's chart and she asked the nurses, well, why is she not going? Well, we don't know. Did you ask her? No, we didn't ask, we just wrote. So she went in and she talked to the patient. And what she found out was that the patient's hair had not been washed in a month since she had been admitted. She said because the products that we had was not working for her hair. And as a teenager, she was embarrassed to go to therapy with the other kids or teens because of her hair. So once we were able to get in a product that worked for her hair and her hair was washed and styled, guess who was the first person in therapy? She was willing to go. It was that simple. And so we have to actually ask ourselves as students, as nurses, why the why. You don't always assume that a patient is being non-compliant without finding out why they're being non-compliant. And it might not necessarily be just because they don't want to do something. It might be because for other reasons. And so I wanted to share that story with you. So when we actually decided to select a shampoo, conditioner, and hair lotion for our patients, we used 6 criteria. We wanted to look at the results from our staff surveys. And our patient surveys. We wanted to look at availability because this was during the COVID time. So not every product was available when we needed it, right? So we wanted availability to be one of our top criteria. And we were really thankful because the shampoo, conditioner, hair lotion that we used was actually being made in Columbus. So it was very easy to get to, and the warehouse wasn't far from us. Feasibility, we looked at packaging. Those large bottles, a lot of the hair supplies were coming in large bottles, and that wasn't feasible for us because we were having to squirt that shampoo and conditioner in a medicine cup, which is unsafe. So what is it that we could do where we would have individual packages? We're looking at safety control as well. We wanted to make sure our patients didn't have any infections as a result of getting shared products. We wanted to find a product that was good for all hair types so that our staff wouldn't be confused about what hair products to use for which hair type. And so we actually came up with a product that could be used from type 1 to type 4, to any hair type that we had on the floor. They could use the same product. The only thing with the product that we chose was that the hair cream probably would not be recommended, and that was because it had more of an oil base in it. And so a type 1 hair type might feel a little bit more weighed down with it. And so, but the shampoo and conditioner still has some moisturizer in it. And so the hair would still come out silky for their hair type as well. And then we also consulted with our community dermatologist to come up with the best product. And so we did. And so I'm not, the hair product, I'm not going to show you the name of it, but this is what we now have. We have a wide tooth comb, we have a detangling brush, a hair bonnet, we have a detangling spray, and we have hair shampoo, conditioner, and moisturizing lotion that can be ordered through our supply chain at any time for our patients. And so as Laura had indicated, just a quick project a timeline here. I'm not going to, again, as Laura stated, I'm not going to go through all of them. But what I can say is our crowning joy was that our hospital was featured in April of 2022 on Good Morning GMA 3, Good Morning America 3, their third segment. And so that was really impressive for us. We were really happy to do that. We have represented through several national organizations around the country. And we probably, Laura was number 1, but we were not too far behind her in starting our project as well. And we actually just was awarded a 3rd grant. So we were able to put together in the fall of 2022, over 500 hair care kits that we were able to give away to our patients and families, including our Ronald McDonald House that we are the, I think we're the largest Ronald McDonald House in the country. And then we were also able to share with our family safety and healing and our foster care parents as well. And so with our 3rd grant, we're going to hopefully put together some more hair care kits that we can give away in the near future. I was really excited in January for Martin Luther King's birthday. In honor of his birthday, we had a daddy salon. And so we're hoping that we can actually do that again for Father's Day this year. So let me, I'm going to talk really quickly. I don't want to take away time for our hair care conference, but I do want to talk about our webinar series. Laura and I, this was our brainchild. We came together and said, what if? And it was amazing what happened. So we collaborated with CHOP, Children's Hospital in Philadelphia, St. Louis Children's, Nationwide Children's, and also the Children's Hospital Association to have this hair conference in October of 2022. We had this presentation was over 4.5 days. We had 5 virtual webinar series and the topics included leadership, direct patient care that Laura and I did together, and supply chain sessions. And then we had a national impact panel where we had parents that actually talked to during the webinar about the impact of hair care equity for their own children. And then we had a national advocacy panel as well. And at the end, as our crowning act, we were really blessed to have Mayor Tashara Jones from St. Louis to provide a video recording for our project, and also Congresswoman Frederica Wilson, who talked about the Crown Act and also just congratulating us on our project. So it was over 366 total registrants for this webinar with over 41 organizations nationally and internationally. We definitely know someone from Germany clocked in, and we think a couple of other countries as well. So we were really happy. And what you'll see is the 4, the green are those who were sponsoring organizations. And so our attendance, Laura and I had one of the highest. We were really happy about that. Our keynote address, she was amazing. Dr. Sherry Hicks Graham, she was actually the one who designed our hair care product for Nationwide Children's. And so she specializes in ethnic hair problems. And so we're really happy to have her here as our keynote address. And then here's some our conference outcomes and future goals. We want some national benchmarking, and I think we're actually reaching that goal. Boston Children's has actually reached out to Laura and I about starting their own project with Harvard University. We have multiple pediatric and adult organizations that have launched their own projects. We are instrumental in starting some parent and caregiver classes. As I stated earlier, we have a large foster care population, and so we want to provide some caregiver classes for those families so that they can, with a cosmetologist, so that they can get some hands-on learning. We're going to continue our lunch and learn demonstrations and then creating more teaching tools and toolkits for our staffs and caregivers. And we want to expand our mobile simulation program, where we're hoping that each individual institution will have their own so that they can teach their staff members how to properly take care of curly and coily hair. And so moving forward, we are thankful for all the opportunities that Laura and I have had to share this program with you and with others. It's been a great experience, and we are hoping that we will continue to move forward in providing the best health equity for our patients and families. But I want to leave you with a final quote that says, one of the most powerful gifts that we can ever give our children while they figure out who they want to be is to let them know how much we love who they already are. Thank you.
Thank you so much, Terlina and Laura, for sharing your knowledge and from speaking from the experiences that you both have had, as you both have done such amazing, wonderful work. I can't thank you enough. We do truly appreciate your time and your expertise, and definitely look forward to sharing what we've learned today in both our personal and our professional spaces moving forward. There were a couple of questions that came through the chat section, which were answered. Thank you, Laura, for doing that as we've been going along. I wanted to open the floor to see if anyone else had any additional questions that they would like to ask. I see Terry, I just posted one in the chat. Before we get started too, I also wanted to note, just in case you did not see it in the chat section, that the recording of this presentation will be distributed to all registrants by the end of the month, so the end of February. And the recording will also be made available via link access on the College of Nursing's YouTube channel. So with that, go ahead, Laura.
Sorry, Michaela. I was just going to address Terry's question. I don't know. I will let Terlina answer for her area, but we have not yet ventured into the nursing schools, at least in our regional area. That is something that our work group wants to do. Our work group is 6 people who all have other full-time jobs, and so this work is done on top of, and so we're trying to also recruit some more people resources. But yes, we also want to reach out and partner with the local nursing schools to figure out how this is fundamentals of nursing, and we want to figure out how we can get it embedded there as well, but we've not done that yet. I don't know, Terlina, if you all have had a chance to partner with any of the nursing schools.
As we spoke last night, funny that question came up. I spoke last night to OSU nursing student. Actually, they have a group called Nurses of Color. And so I spoke briefly about the project. I'm going to continue to have ongoing relationships with that group. And so I'm hoping that will be the first group that we will be providing this information to. But I'd love to continue working with nursing schools moving forward. So more to come, Laura.
The great thing that Oh, I'm sorry.
go ahead.
I just cut someone off. I was just going to say the great thing about this webinar, and again, we nerd out about this and we'll like talk about this all day. So I will edit myself, but truly, Serlina and I met virtually, and it was really us just talking about our own projects. And we were like, oh my God, how cool would it be if there was like a conference about this? That's how the webinar series started. It was truly just us nerding out about it.
Yeah,
And
we were
fortunate,
nerds.
yes. Well, we still are nerds, Serlina.
We are.
We are. And being able to connect with Children's Hospital Association because they saw it on a listserv. We put it out on their listserv of like, hey, if we did this conference, would anybody be interested? And it like blew up in the best way.
It did.
And so CHA reached out and was like, hey, how can we be involved? And so I bring that up only because I know Serlina and I both are so excited about the reach that we've been able to have as part of the webinar series and networking with other folks, because and the purpose of all of this is really to advance this everywhere. Like, this shouldn't be something that each hospital has to do on its own. This should be something that is a national standard. And that's what we're advocating for. That's what we're hoping to do, is to help organizations kind of get started, but then really shift it to how do we systemically address this, so that it isn't just each hospital having to do this and find these products and do this education, but rather it is in nursing curriculum. It is, part of just kind of the standard of care that we provide for not just pediatric patients, because our adult hospitals do not have, I will use my I voice here in St. Louis based on what I have heard from my colleagues. Our adult hospitals also have a tremendous amount of opportunity to improve their hair care equity as well. So it's really a national healthcare issue. It's not a pediatric healthcare issue.
And I would say that I actually had a hospital in Vermont reach out to me, and I've had multiple conversations with their nurse educator because they just got an influx of migrants into Vermont. And so they were stuck. We don't know what to do with their hair. What do we do? And so they reached out to me, and I was able to provide education and share our education modules with them and help them at least get started and tell them the type of products and where to get the products, because they just didn't know. And so sometimes it's not that they don't want to do it. It's just that, number one, the light bulb never came off. They never realized that this was even a need. It was more of, okay, we've always done it this way, let's keep doing it this way. And then the other thing is that they just don't know or understand that there are differences when it comes to hair. And that has nothing really to do with ethnicity. It has to do with the importance of hair, just like your skin. If your skin is not moisturized, it's going to be dry, it's going to break, it's going to, you're going to start having some ulcers and injuries to the skin. And so the hair is the same way. And so we need to make sure that from this group that you can spread the word that hair is still a part of us. And we need to make sure that our patients are well groomed, because there are actually studies have shown that when a patient is well groomed in a hospital, they actually have better health outcomes. They're actually discharged from the hospital faster because you wash their hair. So understand how important that is, that hair care really does make a difference.
Anyway, I wanted to just say to both you, Laura and Serlina, I am so totally excited. This is the work that I do. You all, we are so aligned in our work and our focus. And I was like, I haven't heard of them. And I want to, I shared with Michaela, I have a book called Talk, Touch, and Listen While Combing Hair. We have a chapter in there about an attempt we did here. This is years ago with a hospital to introduce the hair combing time as a time to connect with parents with hospitalized children. So I would love to have a conversation with you all both about potential collaborations, use of some of your products with our parent groups around Talk, Touch, and Listen While Combing Hair. I put that in the chat box. There's my email address. I am over the moon with the work that you all have done and the comprehensiveness of it. It is a wonderful, wonderful addition to what, and I agree with you in terms of nurse practitioners, but others. I'm a psychologist, I work with social workers. Folks need to understand this tiny, tiny, tiny little task can make such a difference in the lives of children, infants and toddlers and children. So thank you all so much for this. I hope we will be able to have some type of ongoing relationship. Please, please, please contact me. I'm looking forward to having a conversation with you all.
Yes, you're
Thank
a nerd
you.
too.
Yes,
We'll nerd
yes.
out with you
Oh,
about
yes,
it.
yes.
Yay.
I wrote down your email address for sure. I don't know if you were on when we got started, but we were joking about getting this wonderful opportunity to present these different spaces, and we were joking about like the answer is always going to be yes. And Serlina's like, I don't know if your calendar will work, and I'm like, we're gonna make it work. It'll always be a yes. So the answer is always yes, that we will figure it out. So absolutely excited to connect with you and figure out how we can move this forward. And to your point about interdisciplinary collaboration,
Yes.
and I know that we're almost out of time because I could talk about this forever. But we also, as part of this webinar series, it wasn't just nurses who attended. There were physicians who attended, advanced practice providers who attended.
Excellent.
There also were occupational therapists and physical therapists.
Yes.
And the National Organization for Occupational Therapy, we've also made a connection with them and are working to help create some toolkits with them too. So it really has springboarded this into a way to hopefully embed it into all things related to healthcare so that we really can improve equity in this way.
Michaela, if you can save the chat information for me.
Yes,
Lauren,
on it.
yes, because Laura and I are going to try to put together an FAQ. That's one of our to-do lists, so that we will have that when folks are asking questions, we will automatically have that there for everyone.
I just wanted to chime in. I know the meeting's almost over. So when I was about 16 years old, I volunteered at a hospital for adults. And I remember I was walking around handing out ice and blankets, and there was a Black woman in the hospital, and she was like, "Oh, I just wish somebody would comb my hair. Nobody's touched my hair." And this was when I was younger, which today I had now have my master's in public health. And I just wanted to say, I think that this should be more than just, occupational therapists and physicians. This can even go beyond for volunteers to be educated on different hair textures and the ways of maintaining hair. And even like a coalition or a group of people that can be even nationwide to perhaps go to hospitals or see if hospitals need people who are adverse in using hair products or combing hair, braiding hair, because it does matter, and hair equity is important from a public health standpoint. So maybe not a physician, but I do have my master's in public health.
Yes,
So
I agree with you. One of the things I would say is that actually from the GMA3 presentation, there was some negative remarks on there. One of the ones was, well, why don't they just get cosmetologists just come to the hospital and do people's hair for free? That's just a waste of hospital resources. And I didn't respond to it, but I will say to this group that you can't just bring people into a children's hospital and have them touching patients' hair. It doesn't work that way. There are rules and regulations that go along with that. And so the easiest thing to do is to train your staff how to use the products, because they're already being paid to do the job. So I just wanted to put that out there, because people think that it's really easy to just bring people in and do hair, and it's not that easy. But I love your remarks, Courtney, because it would definitely be nice to partner with outside organizations, as we've done with especially cosmetologists, to who are the experts, to show staff members how to do hair properly.
I think we have time to get two more questions. Sue, we'll do yours first, and then Teresa. And quick question before everyone hops off in just a little bit. Serlina and Laura, are you okay if we share your contact information as well?
Yes.
Perfect, thank you.
Just quickly, I love this conversation about the therapeutic ramifications behind hair and hair care. I feel like nursing, was rooted in some really intimate kind of connections with patients way back when, right? And then we've started to infuse science and all these other roles, and I feel like we've moved further away from the basic care, which to me aligns with having that intimate contact with your patient and how therapeutic it ends up being. And I'm hoping that nursing in general kind of takes a 360 and really thinks about these moments where we're doing things like hair care or bed baths and not continuously hand them off to someone else to do that, because I feel like there's a therapeutic benefit for all that can be involved in those moments, right? And getting back to the cafes on talk and how, again, it brings us back to those intimate connections. And I think there's value in that. And so it just made me think about how something as simple as providing hair care could be therapeutic in its offering. So thank you again, loved it.
Yes, totally agree. Thank you.
I'll go really quick. This is Teresa. I'm faculty at the College of Nursing in the undergrad program and also a Latina. I appreciated your sharing your data on the number of nurses that you have. From 2013 to 2020, the increase in Black nurses was minute compared to the increase in the population of our Blacks. And the same can be said for the Latinos, but there are many students on here. And I just want to remind everyone that whenever a patient is looked at as another, the others, that they are the persons who are neglected in some way. And in these post-COVID times with all of the staff shortages, many hospitals are inviting new members to their staff that will do things that the RN doesn't have time to do. And bed baths and hair care is under that umbrella. So and I agree with Sue, when we give them a task list, we pull away from the caring of that patient. And, they're busy, so they have a checklist, but we somehow have to, as we delegate to them, let them know how important it is. And I will comment that as a person of Latina background, my hair is also part of my culture, and the touching of the hair for Latinas is also not allowed, and people will want to touch it. And I think that for all of us, we need to know that anytime someone is an other, there is probably something to learn about when you're considered an other.
I want to just add one more thing. We also, in preparation for this webinar, social media stalked the people who are in charge of the Crown Coalition, literally looked them up and just cold emailed them and was like, hey, we're doing this thing. Can you help us? And they didn't know who we were. They weren't particularly interested at the time, right? It was this unknown thing. But our plan is to continue to reach out to them because their focus has really been erasing race-based hair discrimination in the workplace and in schools. But it would be amazing if they could also put healthcare under that umbrella and use their the force and their recognition and the power that they have to really move this forward too. So I will continue to nag them and try to see how we can also become a part of the work that they're doing so that we can have a much bigger reach as it comes to healthcare.
And Teresa, I just wanted to point out too that my other percentages, those were actually people who identified that way. And so it wasn't that there were other races, but it was people who said they just checked that other box instead of identifying their own specific ethnicity. So I just wanted to clarify that. But thank you for your comments.
Well, awesome. I'm loving this discussion, and I hate to have to end it, but thank you again, Serlina and Laura. We will make sure that your contact information goes out to all registrants so that we can hopefully look forward to partnering with you all, particularly within the College of Nursing and the Anschutz Medical Campus moving forward, because you all are a wealth of knowledge, and it has certainly been a pleasure to connect with you all today. So thank you, thank you, thank you.
Thank you for having us.
And thank you all for coming.
Thank you.
Yes,
Thank you,
thanks.
Michaela. Thank you, everyone.
Anytime.
Yeah.
Have a wonderful day.
Bye.
Bye-bye.